Understanding the disease pathology of schizophrenia. Manifestations of schizophrenia are commonly divided into positive, negative, and cognitive symptoms. Positive symptoms are most readily associated with the disorder and are the target of currently available treatments. Yet cognitive and negative symptoms also have a substantial impact on patients' ability to function in society, with existing treatments not being effective for these symptoms. Schizophrenia is the 15th leading cause of disability worldwide and directly affects over 21 million people. Schizophrenia impacts individuals' ability to work, care for themselves, and interact socially, leading to stigmatization, reduced independence, and feelings of isolation. The pathophysiology of schizophrenia. Research has generated several hypotheses for explaining the underlying pathophysiology of schizophrenia. Here, the focus will be on dysfunction in the nigrostriatal and mesocortical signaling pathways, which are rich in dopaminergic and glutamatergic connections as a basis for positive, negative, and cognitive symptoms, although the full picture is likely more complex. The proposed pathophysiology of positive symptoms. The corticostriatal thalamic circuitry spans the substantia nigra, subthalamic nucleus, thalamus, globus pallidus externus, striatum, and the cortex. Each structure is connected via predominantly inhibitory GABAergic or excitatory glutamatergic neurons. The medial prefrontal cortex, cingulate cortex, and precuneus have been associated with self-referential processing in schizophrenia. Corticostriatal signaling within the mesocortical pathway is associated with insight and expression, and nigrostriatal signaling between the striatum and the substantia nigra is linked to the attribution of salience to stimuli. In patients with schizophrenia, dopamine levels are increased in the striatum, increasing stimulatory effects on dopamine D1 receptors and inhibitory effects on dopamine D2 receptors. Excessive dopamine signaling via the nigrostriatal pathway also leads to disinhibition of the thalamus and overactivation of the prefrontal cortex. This creates salient associations with irrelevant stimuli, which may be linked to hallucinations and delusions. Proposed pathophysiology of cognitive and negative symptoms. Areas of the cortex such as the dorsolateral prefrontal cortex or anterior cingulate cortex have a key role in cognitive processes, such as memory and executive function, as well as motivation and sensation seeking. In patients with schizophrenia, reduced activity in the excitatory cortical glutamatergic NMDA receptor is proposed to lead to increased inhibitory GABAergic interneuron function, and thus decreased dopaminergic signaling in the prefrontal cortex. This dysfunction in glutamatergic signaling is thought to contribute to the cognitive and negative symptoms of schizophrenia. Treatment of symptoms of schizophrenia. Dopamine D2 receptor preferring antagonists or partial agonists block striatal dopamine D2 receptors, preventing dopamine from binding and in effect reducing the experience of positive symptoms. Although efficacious in reducing positive symptoms, dopamine D2 receptor blockade has been less effective in treating cognitive and negative symptoms. Overblockade of these receptors within the nigrostriatal pathway can also lead to increased involuntary Parkinsonian movements via extrapyramidal side effects such as akathisia and tardive dyskinesia. Current research goals include improving treatment of negative and cognitive symptoms, reducing side effects, and targeting additional processes that may be involved in pathophysiology, such as dysregulation in glutamatergic signaling, with the overall goal to improve the lives of individuals with schizophrenia and support their ongoing personal and functional goals.